The Irish Nurses and Midwives Organisation said today that the overcrowding crisis warrants an extraordinary response from government and the HSE. The number of patients on trolleys reduced today to 838, down by 93 patients compared to yesterday's record figures. The hospitals worst affected today are University Hospital Limerick with 76 patients waiting, Sligo with 65 and Cork with 62. The Irish Medical Organisation has called for 5,000 more beds to be put in place.
Until we have the capacity in terms of acute hospital beds, step-down facilities, rehab facilities, intensive care bed facilities, we're not going to be in a position to address this. So it's a very simple fix, but it's an expensive fix.
The Social Democrats said the government had failed to adequately plan for the winter surge.
We need to ensure that alternative healthcare facilities are open longer hours. You know, it's all very well advising people not to go to ED, but in many cases there is no alternative.
The Taoiseach said it was unacceptable that ill patients are being left for hours or overnight on trolleys.
Of course it's not acceptable, but the government and HSE are doing everything possible to improve the situation. We've 1,000 more beds than we had only 3 years ago.
Minister for Health Stephen Donnelly briefed Cabinet today on the pressures, and he said consultants are being asked to come in at weekends for the next few weeks to help. The HSE has warned that hospital overcrowding could get worse. Today the government said that all available private hospital capacity should be used. And so far, the HSE has secured the use of 185 private beds to ease pressures. Meanwhile, with the rise in respiratory illnesses, today the Chief Medical Officer, Professor Breda Smith, urged parents to keep children home from school and childcare facilities if they are displaying new symptoms of illness. Fergal Bowers, RTE News.